And Governor Green, also a physician, went on to speak about how contagious measles is and how it spreads. Now, continuing our team coverage, Kimber Collins spoke with a pediatrician today about the disease, the vaccine, and options for kids and adults.
With the risk of the disease now reaching the islands, the Centers for Disease Control said there are symptoms to watch out for. Here is a look at those symptoms on your screen, including what's known as Koplik spots, or tiny white spots inside of the mouth about 2 or 3 days after showing symptoms. According to the governor, measles disease spreads fast.
It can linger in a room for up to 2 hours after someone leaves. Like if a little kid was sitting here for one of our ceremonies and had the measles, the next group that comes through, you could catch it.
You saw this disease firsthand in Samoa in 2019. So when you hear that there is now a case in the state, what goes through your mind?
The largest populations in the state that are unvaccinated are a little bit more on the neighbor islands than they are in Oahu. And that requires transport. And if you have a large number of people that are infected, it will overwhelm the neighbor islands, which would mean they would need our help here. And that's not an easy logistic thing to achieve.
The MMR vaccine treats measles, mumps, and rubella and is available starting at a child's first birthday with a second dose at their 4th birthday.
And as long as the child is over 3 years old, they can get the first MMR vaccine. The second one will be explained to them about 8 weeks later.
Health officials say it is not warranted right now, but if cases rise, adults that have been vaccinated can get boosters. With only one case in the state confirmed, doctors say right now is not the time to panic.
We all have the ability to make some very safe choices, and we're giving the community lots of notice to start, thinking about what works best for them, as well their immediate family, as well as what's going to help the community as a whole.
If you do have measles, contact your doctor immediately and stay home for at least 4 days after the rash appears. Kimber Collins, Island News.